What is normal? I mean, really, when we think about what does normal mean? Well, if you look at the dictionary, normal is what's expected, what's typical, the standard results. Whenever we do an analysis, our normal and standard and typical results usually fall within the bell curve. Anything that's different or abnormal or not expected will fall outside of the bell curve. It's an outlier. So if we really want to look at what extraordinary looks at today, we should first figure out what normal looks like in our community and in our nation. So if we are looking at what normal is across the nation and our standard statistics and expectations, and the issue that's close to my heart, normal means we are sicker than ever in our nation today, yet we are spending more money on health care than we ever have before. According to the OECD, health spending in the US is about 90% higher than most other industrialized countries, yet we rank near the bottom in health outcomes. Normal means we are progressing forward physically while sliding backwards socially and emotionally and spiritually, almost simultaneously. Is this the kind of normal we really want for our families, for our community? Well, here's the good news. Midland is definitely not normal. We have some of the lowest unemployment rates in the US. We have the highest average income in the US, the highest median household income in the US. And because everyone wants to move here right now, we have some of the highest cost of living. We rival our friends in New York and California when it comes to our hotel prices and our rent prices and even our gas prices. But isn't that what we've always prided ourselves on? Being the outlaws, being different, not afraid to roll up our sleeves and take risks to challenge the status quo and be different and be progressive? Isn't that how the history of Midland has been forged over the past several decades? I mean, how else does a little desert town in the middle of West Texas rise to the fame we've gotten without being a little abnormal? So what does that say about healthcare in Midland? That's really where I want to start the conversation with you all today. If you think about it, healthcare is the backbone of our community and a key pillar to the growth that we have coming in years to come. If we don't have vibrant and healthy people living their healthiest lives, how do we continue doing the great work that we have ahead of us? I mean, it doesn't matter how bright the mind is or how hard the worker is. You can only do so much if you're laying in a hospital bed on the 5th floor of our facility, or managing a chronic disease, slave to a prescription pad at your doctor's office every week. Spend a few hours in our emergency department and you're not going to see a bunch of traumatic accidents or genetic anomalies. What you're going to see are the same chronic diseases that are plaguing our nation right now: heart disease and diabetes and stroke and hypertension. Our workforce, our teachers, our executives, our road workers, our construction managers being pulled off the important work they have to do every day because of these chronic diseases that our nation is suffering from. So, if we want to look towards building an extraordinary healthcare system, let's take a deeper dive into what normal healthcare looks like in America. And here it is. You get sick, you come to us, we make you feel better, we do a bunch of things to you, we charge you based on all the stuff we did to you, and hopefully, a big hopefully, we get paid for most of it. You come to us, the more that you're sick, the more that you come to us, the more things that we do to you, the more opportunities we have to charge you, the more chances we have to hopefully get paid for it. Your illness is basically our reward. And our reward comes in the form of government-supported reimbursement models like Medicare and Medicaid and insurance companies and your co-pays and deductibles. This is a basic fee-for-service model in healthcare that we've been under over the past several decades. And this is really what we consider sick care, because we're not getting paid to make you healthier, we're getting paid to manage your sickness and disease. But here's the problem. According to the CDC, about 75% of healthcare in America is spent on lifestyle-related diseases. Remember the things I told you are pulling our workforce off the job every day: heart disease and diabetes and stroke and hypertension. These are lifestyle-related diseases, diseases that are largely related to our behaviors and our choices and the food that we're eating every day. I mean, we can give you medications and do new procedures and keep patching you up to send you back to work and back home, but without anybody going to the sink and turning off the faucet and treating the root cause of the problem, we're not really getting anywhere. And what's worse, we can't find anybody to pay for this. Healthcare spending in America is so unsustainable right now, the government's crying uncle. They're coming out with new programs almost every year, putting pressure on health systems like ours to do something about the out-of-control healthcare costs in our community because they can't and they won't pay for it anymore. And the insurance companies are right behind them, reducing reimbursements for the same things that we've done year over year because everyone's trying to recoup the cost. Is this really the kind of normal that we want in our lives, in our community? I'd rather not. In fact, I had to make the very difficult decision in 2015 when I was diagnosed with multiple sclerosis. If I would take this new prescription pad full of medication and this disease progress and progression and slow decline I was told I would have, and take this normal approach to this new disease I was facing, or if I would choose a more abnormal option. So, how do we create something extraordinary in healthcare in Midland? How do we become an outlier in healthcare, just like we have in our oil and gas and every other industry that we've been so progressive in this great community of ours? Well, I was fortunate enough to be introduced and around some incredible, progressive, outlier, outlaw physicians, some of which are in this room today, that knew there was more to disease than slow progression, decline, and medication management the rest of our lives. They weren't afraid to challenge the status quo and challenge their own peers to push back this normal version of healthcare and push towards a better option for our patients and our community. They saw the data and research proving that 75% of healthcare is dealing with chronic diseases, things we're doing to ourselves. So no amount of medication or treatment is ever going to touch this disease like going to the root cause and changing our lifestyle and changing our behaviors and changing the foods that we're eating that are slowly killing us. Now, the challenge here is that we're all part of this problem, right? We all make decisions every day related to our health and the things that we eat and the way that we live and the stress that we take on. But the greatest opportunity here is that we can all be part of the solution. It starts with behaviors. Well, I know what you're thinking, or I know what you should be thinking. How in the world does a healthcare system impact behaviors? I mean, isn't that what counselors are supposed to do? But if you realize that 75% of our healthcare spending is on chronic diseases, lifestyle-related diseases, choices and behaviors people are making, then how else can we effectively treat or help manage someone's disease if we're not talking about the root cause of those diseases? And judging by our bad debt and charity at our local health system, more and more of those bills are getting left unpaid at the end of the year. There has to be a better option. And it has to start with the leaders in our community coming together and choosing to take ownership of your own health and the health of your companies and your families to do something more for our community. And it starts with one key concept: ownership. We have to take ownership of these problems and these issues individually in our own lives and over our families and our companies. And we've done this in our health system over the past couple of years, and the results have been remarkable. Starting in 2014, we started talking about ownership at our hospital and values and how our personal values, whether or not we recognize them on a daily basis, impact our behaviors. And we started informing our employees about how important it was to recognize our own personal values and how those drive our behaviors and impact how we treat people every day. It was an incredible connection that we realized was being made in the connection between values and purpose and health behaviors and the diseases that we're facing every day. So we started sharing this message with our community. And thankfully, we had some great innovative leaders at Midland ISD that were willing to take this journey with us. Together, we collaborated to create the Midland Values Project and start talking about values with our school administrators, with our teachers, and today with our kids in the classrooms, talking about the importance of values, personal values, purpose, and behaviors. And it's having a remarkable effect in the classroom today. Now, around the same time, we started talking about ownership and values. These progressive, outlier physicians I told you about were bringing us research and data that had been around for decades, proving our lifestyle choices, the foods we're eating, our stress, lack of exercise, that's what's causing the chronic diseases that we're managing every day in our hospital. They showed us the research that our food can be our greatest form of medicine or the slowest form of poison if we're not watching what we're eating. Our exercise, our stress, this idea of lifestyle medicine came alive in our health system. And we began talking to our employees and also our community about the importance of our personal behaviors. We also helped start a nonprofit called Healthy City, realizing we needed to take this outside of the hospital four walls, let the community be involved, and really start impacting the health of the community, starting with education and awareness of these key principles to real health. And now today, we realize we have to take a more collaborative approach to healthcare, and we've just started this in our health system. We know we can no longer treat the gallbladder in room 656. We have to treat the person, the whole body, mind, and spirit, taking into account those personal choices, those lifestyle factors that got them to where they are today. And you know what? We have been so creative and so innovative and so passionate about this. We are now the outliers in healthcare in our nation. At Midland Health, we are being asked to speak at international conferences to share the things that we're doing here locally because they are so progressive, they are so profound, yet they are so effective and inspiring to other healthcare leaders across our nation, because this is why people get into healthcare, because they want to help people. They want to heal people. They want to give people hope. And this model of healthcare returns that hope to healthcare and gets away from just the sick care model. We get called on to speak to other healthcare systems in our nation almost monthly to share the things that we're doing, the changes that we've made, the progress that we've made along the way. We're early on in our progress, but we're already so much farther along than many other places in our nation and in our world, and we have been leaders in this area. And this is what makes healthcare practitioners passionate about their work again. If you speak to the people in our healthcare system that have been part of this movement, the doctors, the nurses, the dietitians, they'll tell you this gives them a whole renewed passion for what they're doing. They can give people hope again and not just a prescription pad and this hopeless diagnosis. We've seen people go from wheelchairs to canes to walking again to going back to work after being on disability for months because of their lifestyle changes. Not some revolutionary procedure, not some breakthrough medication, but going back to the root cause and treating their lifestyle. We've seen diabetics become not diabetic anymore, hypertensive, not hypertensive anymore. We've seen people with long histories of cardiovascular disease at the end of their life, the end of the rope, getting their affairs together, thinking that there's nothing left to do, make these few lifestyle changes because they were given the opportunity and the option, be able to avoid an open heart surgery and regain their quality of life like they haven't had in years. I mean, these are remarkable stories, and it makes so many of us so passionate about what we do every day. This is true healthcare, and this is why we got into this business. But this doesn't pay the bills. I mean, it helps us all sleep at night, and it gives us a renewed passion and energy to get up and go to work the next day. But in our traditional sick care model that I just explained to you, it can also erode our bottom line. So this is the fork in the road that we're standing at today in healthcare in the nation, but especially in our community where we have a little bit of control. Now that you know that this traditional sick care model is disease management and medication control, and this is how the nation is doing it, but you know that we are in a community of progress and innovation. And when there is a better option, even if it's the road less traveled, even if there's a few more sticker bushes along the way, even if it's a little more challenging, if it gets us better results, we're not afraid to roll up our sleeves and go that direction. We're not afraid to be progressive and do what other people haven't done yet before because we know it's the better way for our community. If you know we have these two choices, what do you think we should do? Do you want us to keep managing your sickness and disease and patching you up in this traditional model, hoping you feel better the next day and don't have to have too many doctor's visits? Or do you want us to be a more progressive healthcare system that joins with you in this journey towards true health and healing, educates you in the process, gives you resources and support to help you regain your quality of life? Now, I guarantee if you're the one receiving that new diagnosis, you'd choose the latter. But what if you had to pay more for it? What if having an abnormally healthier community, the healthiest in Texas, meant that we had to go off the reservation? We had to allow the traditional funding models to dry up as they already are, while we chose to collectively contribute to better health care here in Midland, Texas. That's really what I want to leave you with to consider today. What kind of healthcare system do you want here in Midland? And what are you willing to do individually and corporately to lead us in the direction that is the best thing for our community and our community's health? Now, as I mentioned in the beginning, I'm not just a healthcare executive or an advocate for holistic health, but I'm also a patient. And being diagnosed with multiple sclerosis in 2015 meant that I could have been speaking to you from a wheelchair today. I could have had a cane walking up here. I could have been shaking uncontrollably, stuttering my words. I could be blind in one eye. I could have been blind in both eyes this morning. I could have woken up and my whole right side was not functioning, because that's how horrible and horrifying and unpredictable these diseases are. But that's not my story. That's not the story I had to live out, because I had another option. Those progressive, outlaw physicians gave me another option that I could use, and I could choose. Food is my medicine. I could look at my lifestyle. I could look at my stress and my exercise, and I could thrive and not be a victim to this disease. And I am thriving today because of that. And I have the MRIs to prove it. The left MRI shows a rather large lesion on my brain when I was first diagnosed. And just 6 months after changing my lifestyle with no medication, the lesion almost disappears. My MS specialists in Dallas say this is remarkable. They've never seen this on an unmedicated patient, because they don't have outlaw patients and physicians in their community doing what we're doing here. And now they're doing studies on what's going on here. Now, this MRI isn't to prove it to me. My quality of life, my ability to go home and play with my kids and spend time with my husband without debilitating symptoms, that's all the proof I need. But this is to prove it to all of you, and to my physicians, and to that next MS patient that gets sent my way, because there has been many that have received the same depressing diagnosis, and they need this kind of hope. They need this kind of information, that they have a better choice out there. And I stand before you as a proud representative of our local healthcare system to say, this is the kind of healthcare that we want to deliver. This is the kind of hope and healing that we want to give our patients the option to choose from. Because this is how we truly become not only the wealthiest, but the healthiest community in Texas. Because at the end of the day, it doesn't matter how much money we have in our pockets. It doesn't do us any good if we're lying on the 5th floor of our hospital, or confined to a wheelchair, or homebound, or a slave to a prescription pad in a doctor's office, or worse, an early grave. It doesn't have to be that way. And we have a better option, and we have the expertise to deliver this kind of healthcare today. But we need you to join with us in this effort, because we can't do it alone. Will you join with us? You have to realize that health is really the first wealth that matters in the end. Thank you.